Good morning, respected dignitaries and dear students. Myself, Devanshi Dalal, Assistant Professor and Clinical Coordinator in Optometry at Department of Paramedical and Health Sciences, Faculty of Medicine, Parul University. It gives me immense pleasure to welcome you all for this webinar on understanding the National Program for Controlling Blindness and its importance as an optometrist. I would like to welcome the guest speaker, Ms. Chandni Patel, MIS Officer and Project Lead at Center for Social Justice, India. Ms. Chandni Patel is Masters of Public Health from Indian Institute of Public Health, Gandhinagar. She carried out internship at National Institute of Nutrition, Hyderabad, and worked on various ICMR projects. She has worked in Gujarat, Rajasthan, and Telangana. She will give us insight on the National Program for Controlling Blindness and its importance in the paramedical, particularly in the field of optometry. Students, try to take this opportunity to learn and gain maximum out of it. Your questions are welcome at the end of the session. May I now request Ms. Chandni Patel, the guest speaker, to deliver the informative talk. We welcome you, ma'am.
Okay.
Please. Yeah,
First of all, I will thank Devanshi and Parul University Department of Paramedical and Health to invite me and to give me an opportunity to take this today's session. Good morning, all. Hope you all are doing well. Today we will know what is National Health Program and National Health Program for controlling blindness and its important as an optometrist. And what is public health? Anyone know what is public health? Okay, public health has been defined as a science and arts of preventing disease, prolonging life, and improving quality of life through organization efforts and informed choice of the societies, organizations, and communities and individuals. Public health is all about the prevention of any disease by approaching preventive efforts and early diagnosis, screening, and treatment accordingly. Global burden of blindness, as per the WHO statistics, 285 million people usually impaired worldwide. 39 million people are blind and 246 million have low vision. 82% people living with blindness are aged above 50, and globally uncorrected refractive errors are the main causes of the visual impairment. Usually 80% of all the visual impairment can be prevented or cured. Prevalence is highest in Africa, which is 1.2%, followed by Asia, 0.75%, and Latin America. The target of NHP National Health Program under National Health Program under National Program for Controlling Blindness is to reduce the prevalence of blindness by 0.25% by 2025 and disease burden by one third from current levels. What are the main causes of blindness? Which is highest leading causes of blindness is cataract, which is 62.6%, and followed by refractive errors, glaucoma, posterior segments disorder, surgical complications, corneal blindness, and others. What is the definition of blindness? Anyone can tell me? Hello? 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 Hello, Devanshi, can you hear me? Hello?
ma'am, we could hear you, but your screen.
Okay. Definition of blindness under NPCB is inability of any person to count fingers from distance of 6 meters or 20 feet. What is the national burden of blindness? Out of 39 million blind people across the globe, India has 8 million blind people. As per 2006 to 2007 survey, prevalence of blindness was 1%. Prevalence of blindness above 50 years people was 8.5%. Children between 5 to 15 years, the visual impairment is 6.4%, and childhood blindness is 0.1 divided by 1000. India was the first country in the world to launch national level blindness control program. NPCB was launched in 1976 as a 100% centrally sponsored program. In 1994 to 95 program decentralized with formation of district blindness control society in each district of the India. What are the objectives of the NPCB? To continue three ongoing signature activities, like a performance of 66 lakhs cataract operations per year, school eye screening and distribution of 9 lakh free spectacles per year for refractive errors, and collection of 50,000 donated eyes per year for keratoplasty, and to reduce the backlog of avoidable blindness through identification and treatment of primary care, secondary care, and tertiary level, to develop comprehensive universal eye care services and quality services delivery, strengthening of existing infrastructure facilities to develop additional human resources for providing eye care in all the districts of India, to increase and expand the research for prevention of blindness and visual impairment, to secure participation of voluntary organizations and participation of private practitioners in delivering eye care, to enhance community awareness through different IC activities on eye care, strengthening and upgradation of regional institutes of ophthalmology to center of excellence in various subspecialties. What are the strategies of the program? NPCB continue to emphasize on the free cataract surgery through the government of India healthcare system and through the NGOs and private sectors. Active screening of population above 50 for the cataract, screening of children for refractive errors, and provision of free glasses to the needy. Coverage of underserved areas, IC activities for creating awareness on eye care in the community, making the program comprehensive by including disease other than the cataract too, like diabetic retinopathy, glaucoma, corneal blindness, retinal surgery, childhood blindness, etc. District hospital also to be strengthened by upgrading infrastructure and contractual staff and funds, emphasis on primary care, and establish vision centers on all PHCs and CHC, also at rural level. Creating multi-purpose district mobile ophthalmic units for the improving coverage. And what is the organization structure for the NPCB, which is at three levels: central, state, and district level. At central level, administration is ophthalmology section, Director General of the Health Services, Ministry of Health and Family Welfare, and under which state ophthalmic cell, Director General of Health Services, and state health societies, and under which district blindness society is working. What are the component and activities under the NPCB, which is 8 major activities, which is free cataract surgery at district hospital and identified NGO, eye hospital, private limited, private practitioners, eye screening and distribution of free spectacles to the school, to the children, and also to the elderly. Collection of donated eyes through the network of eye banks and eye donation centers, diagnosis and treatment of other eye diseases other than cataract, glaucoma, children blindness, squint eyes at district hospitals and also at private practitioners, at NGO, etc. Procurement and maintenance of the ophthalmic equipments at sub-district, district hospital, and vision centers in all the sectors, public and private sectors, from 18 to 19. Training of paramedical ophthalmic assistant posted at PHC and district hospitals, strengthening of eye banks in public sector only from 18 to 19. IC activities on promoting eye care activities and increasing utilization of services provided by the NHM and also by the other incentives provided by the government. What are the tertiary care components under NPCB? Provision of super specialty and referral eye care services of diabetic retinopathy, glaucoma, childhood blindness, retinopathy or prematurity keratopathy, corneal transplantation, etc. Co- Constructions of modular eye operation theaters for providing modern and tertiary level eye care services, training of eye surgeons in various specialty of ophthalmology for skill development, conducting surveys on blindness and visual impairment, trichoma survey, etc. through the identified institutions. What is the performance by NPCB? We can see in 2016-70 to 18-90, the target was 66 lakh cataract surgery in India, and the achievement is higher than the target, which is in 2016 to 70, which is 98%. Uh, and in 2018 to 19, which is 101%. And distribution of free spectacles under school eye screening, the target was 9 lakh from 2016 to 2019, and achievement is 84% to 97%. Collection of donated eyes for corneal transplantation. In 2017, the target was 50,000 collection of eyes for corneal transplantation, and achievement is 65,135, which means 130%. Also in 2018 to 18-19, the target was 55,000 and the achievement is 123%. Treatment and management of other eye diseases like diabetic retinopathy, glaucoma, childhood blindness, and other like keratopathy, etc. The target was in 2016, 17, 72,000, and the number of cases treated is far more than the target, 4 lakh 46 4 lakh 40 4,677, which is 562% achievement. School eye screening program under NPCB, 5 to 7% of children aged between 10 to 14 years have problem with their eyesight affecting their learning at schools. Teachers have been trained to screen the children. Screening is to be done on the annual basis after the confirmation by the ophthalmic assistants. Glasses are prescribed and provided free of cost to the poor. Collection and utilization of eye donation. Corneal blindness accounts for 1% of all the cases of blindness. It is mainly occurs among children and young adults. Donated eyes need to be removed within 6 hours of death of individuals. It is to be preserved in specific solution in eye banks and utilized for transplantation within 72 hours. Eye donation foresight is organized from 25th August to 8th September every year to promote eye donation and eye banking. Development of infrastructure is also important component. The construction of eye wards, operation theaters, dark rooms was taken up during ninth plan of NPCB, mainly in the states covered under the World Bank assisted cataract blindness control project to enhance capacity for the eye care in public sector. IEC activities under NPCB, IEC care taken up by the central, state, and district level. Special campaign for mass awareness are taken up during eye donation foresight and World Sight Day, which is second Thursday of October. At center level, IEC prototype material produced and disseminated to the states. A quarterly newsletter also been started since July 2002. Support to the voluntary organization. Voluntary organizations play an important role in implementing various activities under program for expansion and upgradation of eye care units in tribal and rural area, backward um, areas. A grant in aid of 25 lakhs is provided through the state blindness control societies. MIS is also important component in each national health program to facilitate monitoring of trends in performance and analyzing epidemiological situation, and also in NPCB epidemiological situation on blindness, a computerized information system of 25 sentinel surveillance units located in PSM, which is preventive social medicine departments of medical colleges. The cataract surgery data is stratified for gender, social status, type, and place of surgery. What are the major issues in every national health program and in NPCB, which is low utilization of the allotted funds by most of the state except Chhattisgarh and Sikkim, poor physical performance by many states, delay in NGO payments for performing cataract surgery and other surgery or treatment for eye disease by district program officers, in spite of their uploading of data in MIS. Also, one major issue is the quality issues and poor nominations for the training. Very low or very few nominations of eye specialists are sent by the state for the refresher hands on training. This results in inadequate skill and inadequate trained eye surgeons in the states. Many of states do not have a sanctioned post on post of ophthalmologist in district level and also at state level. Now, what are the role of the optometrists in the public health? Public health is all about the preventive approaches to prevent blindness, to prevent any eye diseases or any complications, and also for early screening and diagnosis. Early screening is also important. Early screening and diagnosis, also treatment accordingly to stop the further rehabilitation is all about the public health. A public health optometrist can lead in many roles that include teaching grassroots level community, eye care personnel, epidemiologic operation, research on various issues related to refractive errors, spectacle use and coverage, and also evaluate rural eye care programs, providing screening and vision service at secondary and tertiary level, detection and management of potentially blinding disease such as cataract, diabetes, glaucoma, research into understanding of global eye needs and solutions, especially in vision correction, vision can services. And also, why national health program important? Because national health program NPCB, why it is important? Because it is important due to important due to aiding and prolonging life through prevention of health issues or any eye issues. Individual can spend more life, their more years in good health with their good health, and it also helps to detect health issues as early as possible and respond appropriately uh, to avoid development of any diseases. Hello,
Yes, ma'am.
hello. Huh. This is my presentation regarding NPCB. Anyone had question for NPCB related to anything related to NPCB, its implementation or anything related to NPCB? Can ask. Hello.
Yes, ma'am, you're audible.
Anyone can tell me what are the role as an optometrist in public health? Any student?
Yes,
Children,
ma'am.
can you please answer? Yeah. Yes, Trevor, try.
Uh, this they help in trying to see maybe possible causes of blindness and to detect early before that happens.
Yes. Anyone else?
And detection and management of different eye disease and blindness and provide the proper treatment as for the disease.
Okay. Anyone can tell me how we will generate awareness among rural area or among tribal area for their eye issues or to prevent blindness? Anyone can tell what are the IEC activities can be done in the community?
by doing medical camps and primary eye examination.
Okay. Also we can hello. Also we can go to the schools and communities at rural area and we can aware them. Uh, we can take place a session or camp on eye care and give knowledge on how to care their eye and how to prevent eye issues and when to reach out the doctor. Also we can tell Hannah.
Yes, ma'am.
Anyone else? Any questions?
Ma'am, I think I would like to ask something on behalf of the students if they do not have any question. Can you suggest one of the best policies or the best way to create awareness which is going on within India these days? So, as an optometrist, we are involved in conducting the camps for free eye checkup, or along with it, we have that awareness sessions as well. So, as of now, what are the new things we can have?
uh, we can first of all we can distribute our target population like children, adolescents and elderly population, and accordingly we can approach them. Like for children we can put a small course or small module in their school, and we can ask schools or we can ask government officials to put the take care of their own health or own eyes or eye care. Or also we can put some modules for adolescents in higher schools and in colleges other than medical colleges. We can also put a small module, a small credit module like public health or any health for awareness small module, so that what agar uh, अर्ली स्टेज पे ही उनको पता होगा, इफ दे नो एट अर्ली स्टेज, तो दे कैन प्रिवेंट ऑल द इश्यूज अर्लियर. सो हम टारगेट पॉपुलेशन वाइज हम डिवाइड करके उनको बता सकते हैं.
Thank you so much, ma'am, for your insight.
Okay. Anything else, Devanshi?
Okay, ma'am, just one more question out of curiosity. Which are the current programs going on in Gujarat for the awareness?
Awareness for the for nutrition. There are ICDS program, even also going on now. COVID program, not separately awareness program, but at each section like RMNCH, reproductive maternal health program, nutrition में ICDS program, immunizations. तो उसमें इस डिफरेंट अप्रोचेस डिफरेंट मीडिया थ्रू के होता है, रेडियो न्यूज़पेपर, even Saptadhara, which is Saptadhara is the group which all in all like audio, video, games, and also through different activities. Not separately any program going on, but in each segment, like it's a maternal care, neonatal care, in nutrition, in every segments there are awareness programming going on in government program, national health program.
Okay, ma'am. Thank you. And a last question, may I?
Yes.
Yeah. So, on behalf of students, I would like to ask one more question. Is it only the rural group which we should target, or do you think certainly, because based on all these programs in which you are involved, is the urban population also need to be targeted as of now?
Of course, urban population has also issue like urban slums, and even in low economic as well as in higher economic populations, there are issues. But I think lower economic segments are not aware about these health issues. They are not aware of when to reach out to the doctor, when to receive treatment, how to prevent diseases. So we can target much more than the higher economic segment to the lower compared to the lower economic segments. There are in each cities there are many big segments like urban slums. They have many problems like TB, eye issues, in all communicable disease as well as NCDs. So we can target rural as well as urban slums, also in higher economical population. But I think economically ज्यादा अच्छे हैं उनमें से पे ज्यादा टारगेट करना चाहिए.
Okay, ma'am. Thank you so much. So, according to you, both should be equally targeted because of the specifically the
Yes,
poor population in the urban areas,
urban
which
area.
are needed to be targeted. Okay, thank you so
Poor
much.
population segment is also very huge in cities. So
Yes, ma'am, certainly.
yes. Okay.
Ma'am, I want to ask question that what are the steps taken for awareness regarding the eye donation?
Eye donation. Eye donation. We can. Hello.
Yes, ma'am.
Ma'am, we are not able to listen to you.
Hello.
Ma'am, now we could hear you.
Okay. We can organize camp at college level, school level, and we can, जैसे हमारे कॉलेज में सबने एक प्लेज लिया था कि we will donate our body after my death. तो एक ऐसे कैंप कर सकते हैं हम कॉलेज लेवल पे, स्कूल लेवल पे, इवन ऐसे सोसाइटीज है, ऐसे ग्रुप्स है, जैसे क्लब्स है, वहां पे जाके हम रेड क्रॉस क्लब है, ऐसे बहुत सारे क्लब्स है, तो हम वहां पे अप्रोच कर सकते हैं और एक अपील कर सकते हैं और बता सकते हैं कि क्या फायदा है उसका, आई डोनेशन के बाद लोगों को क्या फायदा होगा. इस मतलब बाय showing the benefits we can generate awareness regarding eye donation.
Thank you, ma'am.
Ma'am, I am having a question. If we like to do any camp in urban area what will be the legal conditions to do the camp?
Regarding awareness,
Yes, ma'am.
I think there is no legal condition. If you have certified doctors or certified optometrist, you don't need any legal permission to create awareness. You can go to any schools by getting permission from schools, colleges, or any local authorities, to any groups or any clubs or anywhere. You can approach to the NGOs and collaborate with them, and then also you can do camp and all and generate awareness.
Okay, ma'am. Thank you so much.
Hello.
Yes, ma'am. Any other questions, students?
मैम
Yes, Riaz, go ahead.
मैम मैंने क्वेश्चन चैट बॉक्स पे मैम मोकल्यो છે
You have typed the question in the chat box.
yes ma'am.
It's okay if you unmute yourself and ask it right now itself.
I think answer of this question is can give better Devanshi. I am not an ophthalmologist. I am a public health specialist. I can tell you what is the implementation, what is monitoring and evaluation, how to impact evaluation of our project. But this question can I think describe better Devanshi or anyone from your faculty.
Okay, Riya. So onchocerciasis is one of the condition which is because of the parasite, right? As you told, and because it is persistent only in the tropical areas, these conditions you won't encounter much when we talk about our OPD conditions. Okay, so as of now, for us, we have to target on trachoma. Again, it is only prevalent only in the slum areas. Okay, and other conditions, as of now, the deadliest parasite, not the deadliest parasite, but I think we should focus on the deadliest virus as of now, right? All of us are aware about the situation since 2 years, right? So there are numerous conditions which are going on even after the treatment of the COVID-19 related conditions, right? So there are so many ocular conditions which may occur even after your patient has been treated for COVID-19. So as of now, I think if we talk about the deadliest one, then it should be the complications of COVID, and you people are already aware about mucormycosis, right?
Yes ma'am.
Yeah, so the spread of mucor is so fast that if the patient doesn't come to us within a day or two, then it may directly reach to the brain, right? So although the eye is involved first, but we need to take care about all those complications of COVID as of now.
Okay ma'am. Thank you ma'am.
Welcome. Any other questions, students?
One more thing, Devanshi, I would like to tell everyone.
Yes, ma'am.
For awareness, we need to determine the need of the community first, and team up is important. Development of the message is also important. How you develop the message that people can catch earlier. And empower your audience is so important, and reinforce the developed message, and promoting is also important for the awareness regarding eye care.
Yes, ma'am, certainly. So I would like to add one more thing based on a question by Riaz. Whatever you explained, it's certainly true because, like Riaz, you asked about onchocerciasis, right? And what ma'am is telling is you have to target the awareness based on the region, even the race. So there are some conditions which are prevalent only in certain areas or maybe certain countries. Just like onchocerciasis, we do not have many cases in India, right? So the same way, depending upon the region, depending upon the tropical conditions, and also the heredity conditions, we need to focus on the culture as well. So even if we talk about the blindness, which is because of high myopia or the pathological myopia, it is more prevalent in the Asian countries, right? Specifically China. So even if you compare the blindness which is prevalent in China because of pathological myopia, if you compare it to the Indian scenario, it will be less, right? So you need to first go through what is the prevalence rate of that particular condition or the disease and why it is occurring. Okay, so in case of pathological myopia, apart from the other situation, your near work and the heredity is the most important factor, right? So if you divide all those conditions according to the positive factors, then you can better go ahead with the awareness. Am I right, ma'am?
Yes, yes. Okay.
Ma'am, your voice is breaking.
Anything else? Any questions, any feedback, comments are welcome.
Students, do you want to add something or do you want to ask anything to ma'am?
Ma'am, I'm having a question. I'm interested in doing awareness and camps. As an optician, what should I do?
Awareness on?
Uh, Awareness and camps on related to eye. So, as an optician, what should I do, and what can I do, and all that?
Okay, so he probably wants to undertake this burden as a single person, one-handed army for the awareness, right? So he has an optical background and he wants to take care of it instead of merging with the other people as only an optometrist, and along with the opticals, he want to go ahead with awareness. So he wanted to
Okay.
ask whether how he should approach different people, right, Mustaqim? This is what you want to ask: how to
Yes,
approach
ma'am.
and
Yes, ma'am.
how to start. Okay.
Okay. First of all, create and tell your develop key messages. Ensure that staff and volunteers and volunteer and other people understand and can deliver key messages, and that everyone is speaking from the same script. Engage the media, different media. You can use banners, video, audio, and other all media. You can all social media. Also identify the target audience and create objective for each audience, like I told you, for children, adolescents, elderly populations, and accordingly you can aware them.
Okay, ma'am. Thank you so much.
Also you can sponsor spectacles and in the schools, students, those who are needy.
Okay, ma'am.
That all from the students. Any other questions?
Ma'am, I have a question. Can I ask?
Yes. Yeah, sure.
What are the precautions that we have to adopt as an optometry or a student while launching any program or before doing any public activity?
Hello.
Ma'am, do you want me
Hello.
to repeat his
Devanshi, can you repeat what is the question?
Yeah, he wanted to ask, he is a first year student, so he wanted to ask that as an optometry student, what are the things he should focus on during his learning phase so that he could go ahead with better awareness programs.
Okay. Uh, Training is very important. Uh, Training is very important component of all the segments in the public health. To learn your refraction and related to procedure for evaluation. Also, you can learn, unless you evaluate, you can diagnose what are the eye issues, and what are the eye issues, and how you could address them. You can also refer to the higher treatment or higher care. Hello. So you should learn to diagnose and then the awareness.
Yes, ma'am. Thank you. So, Rajesh, were you able to listen to ma'am for your question?
Yeah, ma'am. Thank you, ma'am.
Okay. So basically, she wanted to focus based on your learning part, right? So first thing is you need to diagnose. You need to understand, like she said, the target group. So once you are in the learning phase, you need to know what is your target group based on the diseases, which are the positive factors, and which is the condition you should focus first, right? So during her presentation also we saw that there are certain conditions which causes blindness and which are preventable, right? So based on all that, we need to focus on the group. So for your learning part, you need to learn what are the conditions, how to diagnose them, and then go ahead with the awareness programs.
Okay, ma'am. Thank you.
You're welcome. If no questions, then we can move further. If any questions remaining, you can directly unmute yourself and ask to ma'am. Is it all from the student side?
Ma'am, I have a question. Can I ask?
Yes, Shweta, sure. Please go ahead with your question.
Ma'am, if the camping is only one the way for awareness, or we can apply another way to for the awareness for our urban peoples to make more
Shweta,
understandable.
sorry to interrupt you. We were not able to listen to you. Can you please repeat your question? Can you go a little slow?
Ma'am, is camping is only one the way to make people understandable, or there are many ways to for the awareness?
Okay. Ma'am, her question is the vision screening camp only the way for the awareness, or there are other options to increase the awareness? Right, Shweta? Is it what you were
Yes,
trying
ma'am.
to
Yes,
ask?
ma'am.
Okay.
Shweta, screening is important to diagnose the disease as early as possible, but of course we can do and approach the preventable campaign. For prevention, we can do campaign as early I told you, that for prevention of any disease or prevention of healthy eye, of any disease. for we can educate and we can give knowledge to the to our target population like children, elderly, and any adolescents. So screening is the second step, but we can also prevent any disease before development of any diseases. Camps are different types: diagnostic plus referral, diagnosis plus management of any diseases, or diagnosis and surgery options at the same site.
Okay, ma'am. Thank you.
Thank you, ma'am, for answering all our questions. Children, if no questions, I would like to conclude the session. Are there any questions left?
One more question.
Yes,
Can I-
Rajesh, please go ahead.
As we are on the topic blindness, what are the treatment or what therapy can we provide to the blind people just as an optometry student in first year, second year onwards?
I think,
Uh,
Rajesh,
as-
I can answer you better for this.
yes,
Ma'am, may I go ahead?
yes, Devanshi.
Okay, Rajesh. So the first thing is, as in first year optometry student, like we discussed, you need to understand what are the conditions which causes blindness, right? So there are some conditions which can be prevented. There are conditions which can be avoided, and certain conditions which you cannot correct, right? So first thing is you need to approach and try to avoid the conditions which are leading to blindness. Okay, so for example, if I give you an example of refractive errors, if you see the statistics all over the world, there are numerous cases where there is a blindness because of the refractive error itself, except going to the other disease part, right? So even if you just correct for the refractive errors, you can save from the blindness, the conditions leading to blindness. Next comes your burden of cataract, whether it is a congenital cataract or the developmental cataracts or the cataracts in elderly. So all those conditions, again, you know that if there is a cataract, you can simply correct it with a surgery, right? But if you do not correct it for a long time, the complications can lead to blindness. So the second one is the cataract. In that condition, as an optometrist, your role is for diagnosis and referral. So like ma'am said that there are different types of vision screening camps, right? Just the screening and referral, or the screening plus management at the same site. And also there are certain camps in which you can have an option of vision screening plus management, and also you can have a surgical setup at the same site. So based on that, you can decide what mode you are choosing. Right. So again, that question comes back to the same answer, that you need to learn about the conditions first. Am I true, ma'am?
Yes.
Rajesh, was I able to answer you correctly? Or any
Yeah,
other?
ma'am,
Okay.
yeah, ma'am, thank you, ma'am.
Okay, so on behalf of the optometry department, I would like to thank Ms. Chandni Patel for sharing such an important insights on the crucial topic for benefits of students in optometry. It will certainly help them to understand the crucial topic deeply and also engage in the related activities for the noble cause of blindness control in the country. I'm thankful to Ms. Chandni Patel for taking out a valuable time from the busy schedule to present this talk for us and also answering to all our questions. Thank you, ma'am. I'm thankful to the principal, Mr. Hemant Patadia, sir, for permission to organize such an important talk. I would also like to thank Ms. Dhruvi Patel, ma'am, for the necessary arrangements to conduct this webinar. I'm thankful to the webinar coordinators for the arrangement and help throughout the session. Thank you so much. And I'm thankful to the management of Parul University for the necessary infrastructural support for this event. And last but not the least, I would like to thank all the participants for their patience and interactions. I sincerely hope this learning from today's session will be helpful to all of you and give you share in the noble cause of blindness control. Thank you very much.
Okay. Thank you, Devanshi and Department of Paramedical and Health of Parul University and all the participants. Thank you all. Thank you for attending this session.
Thank you so much, ma'am.